First up right now at 5 on this Tuesday, the coronavirus here in Connecticut. Plans are underway right now to start distributing COVID-19 vaccines statewide. Between 20 and 40,000 shots could be ready to go by the end of this year.
And healthcare workers are expected to be the first to get them. But what about the rest of us? Chief Capitol reporter Susan Raff is live with the very latest details. Susan.
Erin, good evening. Hartford Healthcare plans to distribute these vaccines. Healthcare workers will be at the top of the line. They are the frontline workers. What about thousands of others? They may have to wait a little bit longer. Healthcare workers, maybe by the end of this month. As for thousands of others, probably not until the spring, early May or June. That way, they can build up enough supply to safely vaccinate those who really need them. A COVID vaccine is coming. Pfizer and Moderna are now waiting for the green light from the FDA to start rolling out millions of vaccine doses. Here in Connecticut, healthcare workers are expected to be the first to get the vaccines, and then the general public. The state has formed a vaccine distribution group. They are working on a plan to register vaccine providers to make sure there is available storage space, which meets refrigeration requirements, and which residents should receive the vaccine first to stop the spread of the virus. There have been some concerns about the vaccine's safety.
We're going to talk the talk when it comes to this vaccine, and we're going to walk the walk as well. And hopefully by doing that, we can encourage folks to get the vaccine, take the vaccine, because I want people to understand that this is a moment of hope for us.
Doctors say they do have more treatments now and medications such as steroids and remdesivir. And fewer patients are now being put on ventilators, but they say it's not enough. They are still seeing a lot of suffering.
We've witnessed what happens when families have loved ones who are sick and they can't visit, and those people sometimes pass away. We've also witnessed the absolute transformation we've made in the way that we treat the disease, which has saved a lot of lives.
While healthcare workers will be among the first to get these vaccines, some feel that that definition should be expanded. Healthcare workers, not only those doctors and nurses who work in hospitals, but others who work not only in nursing homes, but other healthcare facilities. And coming up on Eyewitness News at 6, we spoke with a registered nurse who shares his thoughts on why it's important to treat all of them safely and quickly. We are live. Susan Raff, Channel 3 Eyewitness News.